Hello friends. Today we will discuss about essential medicines and rational drug therapy. Myself, Dr. Narendra Parihar, Assistant Professor, Modern College of Pharmacy, Nigadi, Pune. Essential medicines. Essential medicines are those that satisfies the priority healthcare needs of majority of the population. Means in a particular area or in a particular community, the needs of the medicines that satisfied by the priority healthcare physicians or nurse. The first country in the world to compose its essential medicine list was Tanzania in 1970. Subsequently, the concept of essential medicines was introduced by WHO in 1977. In the 90s, WHO Essential Medicine List was recognized and as important guiding document mainly for the public sector for the procurement, distribution, rational use and quality assurance of the medicines. So medicines listed in the essential medicine list are intended to be available in adequate amounts in appropriate dosage form and strength with assured quality and the cost that an individual or community can afford. So careful selection of a limited range of essential medicines result in a higher quality of care, better management of medicines and more cost effective use of health resources. So National List of Essential Medicines, that is NLEM. It came with the aim of promoting rational use of medicines on the basis of cost, safety, and efficacy, and to promote prescription by generics name. Government of India has been preparing list of national list of essential medicines since 1996. Experts from different disciplines from medical and pharmaceutical institutes, hospitals from across the country, and concerned government agencies participate in formulation of the list. So these are the respective list of the NLEM which are updated respective year. You can see in 2003, 354 medicines were included in a essential medicine list, and in 2011, 348 medicines. In 2015, 376 medicines are updated in essential medicines. So as per the need, there will be an addition and deletion of the medicines from national list of essential medicines. So what is the purpose of national list of essential medicines? First, the medicines in NLEM should be available at affordable cost and with assured quality. Second, the medicines used in the various national health programs, emerging and re-emerging infections should be addressed in the list. The essential medicines list needs to be country specific, addressing the disease burden of the nation and the commonly used medicines at primary, secondary and tertiary healthcare levels. The NLEM is a dynamic document and feedback from all stakeholders is welcome which will help in its revision and regular basis. Healthcare delivery institutions, healthcare insurance bodies, standard setting institutions for medicines, medicines price control bodies, health economists and other healthcare stakeholders are involved in the preparation of NLEM. The list of essential medicines should act as guide to formulate hospital drug policies, procurement and supply of medicine in public sector, medicine cost reimbursement and medicine donation. So the purpose of NLM is that clearly we can see the medicines should be affordable at cost to any people or any public with a good quality. The medicines used in the various national health programs, they should be addressed in the list. For example, in India there is a programs of tuberculosis. So anti-tubercle drugs should be included in the NLEM. Then the NLEM should be the country specific because according to the geographical the diseases different to the different conditions, so it should be depend on the country specific. Okay, then NLM they include the various healthcare bodies, they include various institutions to make NLEM and come with the purpose. Okay, now we will see next. It helps in monitoring the pricing of medicines. The list serve as a reference document for correct dosage form and strength for prescribing to the physician. Use of NLEM is expected to improve prescribing practices as well as health outcomes. Next, the appropriate use of medicines selected in NLEM promotes rational use of medicines. Such rational use of medicines, especially antimicrobial drugs, reduces the development of drug resistance. The list also serves as a reference for assessing the healthcare access of the population. NLEM serves as a tool for public education and training of healthcare providers. Criteria for inclusion of a medicine in NLEM. First, the medicine should be approved and licensed in India. The medicine should be useful in disease which is a public health problem in India. The medicine should have proven efficacy and safety profile based on the valid scientific evidence. The medicine should be aligned with the current treatment guidelines for the disease. The medicines should be stable under the storage conditions in different geographical areas of India. When more than one medicine are available from the same therapeutic class, preferably one prototype medically best suited medicines of that class to be included after due deliberation and careful evaluation of their relative safety, efficacy, and cost effectiveness. Next, price of total treatment to be considered and not the unit price of a medicine. And last, fixed dose combinations are generally not included unless the combination has unequivocally proven advantage over individual ingredients administered separately in terms of increasing efficacy, reducing adverse effects, or improving compliance. Okay, so these were all the criteria for inclusion of a medicine in a NLEM. Means if you want to add a medicine in a NLEM list, these are the criteria for a particular drug. So the listing of medicine in NLEM is based according to the level of healthcare because the treatment facilities, training, experience and availability of healthcare personnel differ at these levels. So these are the three different levels: primary, secondary and tertiary. So for example, analgesic, antibiotics and anti-malarial etc. are provided at primary healthcare outlet, whereas high-end antimicrobials and medicines for conditions like resistant tuberculosis, malaria, kala azar, oncology medicines, etc. will be required more in tertiary care. So if you want to delete any medicine or remove any medicine from NLEM, these are the criteria. We will see the medicine has been banned in India. There are reports of concerns on the safety profile of a medicine. A medicine with better efficacy or favorable safe profile effectiveness is now available as a alternative. The disease burden for which a medicine is indicated is no longer a national health concern in India. And last, in case of antimicrobials, if the resistance pattern has rendered a medicine's ineffectiveness in Indian context. So these were the criteria if we want to remove the medicine from NLEM. Now come to the next second part, that is rational drug therapy. Rational drug therapy, it is defined as prescribing right drug in adequate dose for the sufficient duration and appropriate to the clinical needs of the patient at lowest cost. So you can see the 5R rules, that is right dose of the right drug to the right patient through the right route at right time. So remember these 5R rules, it's very important for every drug. Any single drug if we are selecting as a clinical pharmacist, it's our role to see all these 5 parameters, whether the dose is right, whether the drug given to the patient is the right, or the drug which we are giving to the patient is the right, or the route which the drug is given with the route is correct, and the time. Okay, remember it's a very important. So right dose of a right drug to the right patient through the right route at right time. So these are the several factors which are responsible for recognition of rational drug use as follows. First is the development of resistance, drug outburst in market, growing awareness, increased cost of the treatment, Consumer Protection Act, and last, adverse effects of irrational use of drug. That is, irrational use of drugs completely goes opposite to the fact of definition of rational use. The ill effects may be immediately or gradual and they may lead to first, ineffective and unsafe treatment, exaggeration or prolongation of illness, distress and harm to the patient, wastage of resources, loss of faith in medical profession, and increase in the cost of treatment. So these were the factors which responsible for the recognition of rational drug use. Okay. Now factors leading to irrational use of drug. Okay. First, lack of information. Unlike many developed countries, developing countries like India do not have regular facility which provides up-to-date unbiased information to the patient on the currently used drugs. Another reason is overburdened medical practice because of lack of medical professionals compared to the existing population. Second, inadequate training and education of medical graduate. Lack of proper clinical training regarding writing a prescription during training period. Dependency on diagnostic aid rather than clinical diagnosis is increasing the day by day in doctors. Third, poor communication between health professionals and patient. Less time is provided by the medical practitioner to the patient for clinical and physical diagnosis and not explaining the some basic information about the use of drug, and it is the one of the basic reason for irrational use by the patient. Next, lack of diagnostic facilities and uncertainty of diagnosis. It is well known fact that correct diagnosis is an important step towards proper use of drug therapy. Particularly, doctors posted and practicing in remote areas have to face a lot of difficulty in reaching to a precise diagnosis due to non-availability of adequate diagnostic facility. So this also promotes the irrational use of the polypharmacy drug. Next, demand from the patient. The belief that every ill has a pill increase the tendency of polypharmacy. Many of the medical practitioners prescribe medicines to satisfy the patient's expectation and demand of quick relief. Then defective drug supply system and ineffective drug regulations, promotional activities of pharmaceutical industries. These were all the factors which leading to irrational use of drugs. Now, what is the role of pharmacists in promoting the rational drug use? First, adopting pharmaceutical care approach in interpreting the therapy and physician's orders in view of improving safety. Maintaining a complete patient medication profile, that is PMR, of each patient. It can help to consolidate all pertinent drug facts into a single set of records to provide the opportunity for quick and easy evaluation by other healthcare professionals. Third, analyzing clinical data to prevent any drug reactions from occurring due to unnoticed or undocumented history of drug allergies and specific genetic composition. Counseling and sensitizing the patient regarding completing the course of therapy and encouraging them to follow the instructions provided on the prescription. Avoiding dispensing prescription medicines without a proper prescription, educating the public on good prescription habits, sensitizing public about proper use of medicines, about adverse effect of irrational use of medicines, and different laws related to the medicines. Practicing medicine dispensing, selling ethically, and restricting suggestion prescription medicines to consumer upon inquiry. So these were all the role of pharmacist in promotion of rational drug use. Means a pharmacist can decrease the irrational use of drugs at a community pharmacy level also. So thank you. In next lecture we will see the code of ethics.